Hi, my name is Miracle Gunani. I'm a data science student at the University of Adelaide, and today I'm going to be presenting my research project. So the topic of my presentation of my research project is the thematic exploration of diabetes medicines at first events through topic modeling from FDA at first events both system datasets. So in this presentation, I'm going to be talking about diabetes and its medication and the 9 diabetes medicines that I used for as a that I'm focusing on in this research. And I'm going to be talking about the FDA first data sets, the methods that I'm using, and then at first event identification, and then the topic modeling and the results, and then the future directions. So diabetes is a serious disease that at firstly affects patient lives. It can lead to blindness, stroke, even lower limb amputations, and it happens to many people around the world. So there are 4 types of diabetes in general. The first one is type 1 diabetes, which is considered as an autoimmune immune disease. In this case, patients have no ability to produce insulin in their body. We know that insulin is the hormone that's responsible to process the acidic glucose inside our body to energy. And because they can't produce this insulin, the option for them is just taking the insulin injection for the rest of their lives. So that's why it's called, for some reason, because their body cannot produce insulin, it's just happened just like that, and it's considered an autoimmune disease. For type 2 diabetes, it's a bit different with type 1 diabetes, which is actually the body doesn't respond to insulin. The option for the patients who are having this condition is that they have to take the drugs. They're available. There are many drugs available out there, and it can be treated by managing or by doing a treatment and managing a lifestyle and some kind of like diet that the patient have to do along with their life. The third one is gestational diabetes, which happens during pregnancy for a woman. And the other one, the next one is the other diabetes, which especially less common types of diabetes arise from various health conditions, viral infections, and so on. So for type 1 diabetes, as I mentioned previously, the patients have to take the insulin shots or injection for the rest of their lives. But for type 2 diabetes, they have options to take drugs. And in this research project, I chose 9 kind of drugs as that I'm focusing on that coming from 3 kind of category. So insulin, SGLT2 inhibitors, and GLP-1 receptors. So there are insulin lispro, NPH insulin, canagliflozin, and so on until dulaglutide. The reason that I chose these 9 kind of medicines is that because previously there is a study done by Stottlemyre et al. In 2023 reveals the difference between diabetes medication from exactly the same 9 kind of medicines, these medicines, but they used statistical analysis in performing or identifying the difference between these 9 kind of medicines, adverse events. And now I'm taking it further by applying topic modeling to these 9 kind of medicines adverse events reactions. So this is the FDA database that can be accessed online, administered by US Food and Drug Administration. And I focused on 3 kinds of files available there. So the first one is drug, which contains the name of drugs taken by patients. And the reaction files, uh, which contains the reaction of the patients when they take some specific of medicines. And then the third one is a demo file, which contains the age-specific data that then I used for creating the age group of the patient. The methods that I've used in this research project. So firstly, I've done the data collection. I downloaded 11 years of data sets. So from 2013 to 2023. And I performed data cleaning. As can be seen here, the drugs itself has 7 million rows, reaction 5 million rows, demographic files has 900,000 rows. So it's an extensive data set. So, and I process them in chunks by utilizing Python dictionary capability. Otherwise, it it will be so hard for my machine to work. And because it's a big data. And then I perform data pre-processing utilizing the Python natural language toolkit, convert text to lowercase, doing tokenization and stopwatch removal. And then I create custom categories for adverse events and by consulting SNOMED City and NIH Library of Medicine, which are the medicine online medicine library. And then I did adverse events identification using semi-supervised machine learning techniques, which is n-grams techniques. I call it semi-supervised because I combine the n-grams technique, which is an unsupervised, with the custom categories of my creation. So it's semi-supervised. I then perform topic modeling, and then I will do statistical analysis afterwards. So these are the identifying the adverse events keywords that I use, and the adverse events are cardiovascular issues, metabolic disorder, until mental disorder. And these are the results of adverse events identified for my 9 kinds of medicines. So this one is for insulin lispro. So the adverse event or the reaction happened to the patient here. For example, for insulin lispro, after a patient taken a medicine, we can see that metabolic disorder is the most prominent reaction that happened to the patient when they're taking insulin lispro. So metabolic disorder and then respiratory disorder, cardiovascular issues, and so on. For NPH insulin, still metabolic disorder is also the most prominent, but the pain here is the most prominent one, and then metabolic and then blood disorder. So these are the adverse events for insulin lispro, NPH insulin, insulin glargine, dapagliflozin, empagliflozin, and so on until dulaglutide. So after I perform adverse event identification, I perform topic modeling, and I specifically used bird topic. So topic modeling is an unsupervised machine learning technique to identify and extract topics. In this case, in my case, it's the first events or reactions from patients. And yeah, it assumes that a document is a mixture of topics, and each topic is a mixture of words. There are several models of topic modelings out there. Some of them are latent direct allocation, bird topic, and top two fact. In this research, I used bird topic because it's a modern approach to topic modeling that leverages transformer-based embeddings to represent documents. The key difference of bird topic to difference to traditional models like LDA is that bird topic relies on semantic embeddings of documents rather than probabilistic models for word distributions. So in bird topic, we can perform the bird topic topic modeling, and then we can visualize the results by displaying the topic word scores and intertopic distance map. So these are my results. I just presenting 3 kinds of category here. So for insulin lispro, the bird topic generated 5 topics. So metabolic disorder, device drugs problem, fetal neonatal disorder, personal independence problems, electrical pulseless activities. This is the topic word scores for insulin lispro, and these are the similarity metrics for the 5 topics. And these are the results for canagliflozin, which is in the SGLT2 inhibitors. And this is the result for semaglutide, which is categorized in the GLP-1 receptor agonist. The common, the common adverse events happen in these three kinds of medicines, as we can see here, is like metabolic disorder happen in three medicines reactions, and then device drugs problems also happen to be the same in these three medicines. And some adverse events is unique to the medicines. Like for canagliflozin, there's fetal or neonatal disorder, which is none in semaglutide and canagliflozin. So these are the results for my topic modeling. The future directions, the next step actually that I will do after I've done the topic modeling, I will refining the topics of the topic modeling itself by maybe by adjusting the number. I've made the logic out of it because we can adjust the number of topics from bare topic, and we can just make the logic out of it. And then maybe the next step is that I will analyze the topic at first event and emerge along with the diabetes medication using non-GANA medicines. Afterwards, I will perform statistical analysis. There are two types of statistical analysis that I will do. The first one is chi-square test to determine if the distribution of topics is actually significantly different across the medicines. And the second one is correlation analysis to assess how different topics are correlated across the medicines. This is my references, and that's all my presentation. Thank you very much.